Dr. Truman, what about from the children's side of things? What have you seen? I'd like to take similar vein that Dr. Watson did maybe back in August when we saw a big spike all the way through now, kind of middle of October. What are you seeing in the Children's Center in PICU?
Yeah, good morning, and thanks for having me. Yeah, we've seen the same decrease commensurate with what's occurred in the adults. We had 39 admissions in August, and then September we were down to 14. And so far through October, I think we're right at 3. So the numbers are definitely trending down. And fortunately, we've had no deaths for September and October.
That's great news. Well, then let's kind of talk about where things stand right now. If you were to take a snapshot of the hospital today, kind of what are we looking at? What about in the Children's Center right now? Do you have any patients, COVID patients in there?
We have no acute COVID patients currently in the pediatric ICU or pediatric floor. We do have one patient with the MISC, that hyperinflammatory state, the multi-system inflammatory syndrome of children. We have one of those patients currently. And over the past month, or in the month of September, we had a total of 9, where we had a total of around 12 or 13 in the prior 10 months combined. But that we were expecting roughly that many to follow the surge that we saw of acute COVID in August.
Can you explain a little bit more, Dr. Truman, that connection between the MISC and COVID, why kids have this reaction?
Yeah, around 2 to 6 weeks after becoming exposed and infected with the COVID-19 virus, the children's immune systems kind of go haywire, and they develop this multi-system hyperinflammatory response where their GI tract, their intestines, their lungs, sometimes their kidneys, their heart. A lot of times their heart becomes affected, and they can actually develop myocarditis. And those are the patients that we've been seeing and treating as a result of the acute COVID surge in August.
Got it. Thank you. Dr. Truman, what about on the children's side of things? Where do we stand with younger children being able to get vaccines?
Yeah, it seems like it's just going to be right around the corner, the next week or two, that the age group 5 to 12 will be approved for the Pfizer vaccine. It will be a lower dose for the children, and right now the logistics of how to roll that out and get most children vaccinated safely and quickly is being worked on. It sounds like everything should be driven through the pediatrician's office. So whether some pediatrician's office will be able to give the vaccine, some I'm not sure, but those plans are all still being made. But when the time comes, I highly recommend that parents seek the advice and counsel of their pediatricians, advice on getting vaccines, and not politicians.
As the numbers trend downwards, what does that mean for our community? What do people still need to be vigilant about? What do you say to that?
Yeah, and I still, I wish either Dr. Truman or myself, I wish we had a crystal ball, but because then we'd be ready to rock and roll. But it's an unknown, right? Because I view it as really 3 key elements with regards to the future of this virus. One is how many folks are really taking vaccination seriously. Okay, that's important. So vaccine immunity is really, really important. How many people have natural immunity? Okay, so how are we going to know that? It's going to be very difficult to know that because many people are testing at home. They're testing in locations we don't have access to. We would have to test everyone to determine what our natural immunity state is currently. And the third thing is really the mutation. So if this thing mutates, if this virus mutates and continues to mutate, then we may have some opportunities in the future for vaccine adjustments and manipulation. So you never know that. But right now, everything is trending in the right direction. You hope that the bodies are producing that natural immunity and going after this thing like our bodies can do. But those are the 3 things that I personally be watching. I'll see what Tom thinks about that. But those are really what I think are going to be impactful.
Gotcha. So then what would you say is your advice to somebody that maybe sees where we're at as far as the numbers in the hospital and thinks, okay, I can go back to living how I did 2 years ago?
Yeah,
Are we there yet?
Yeah, no, I wish. Remember, the rest of the country, so look at other locations in the Northwest, look at some of the states in the North, and they're starting to pick up with regards to cases and deaths. And so we're not out of the woods yet, but I would say the following is that if you're ill, then you need to take this seriously. If you have symptoms, take this seriously. I mean, we're not saying to stop washing your hands and using appropriate thought processes here. You can't go out and run and go to work with a cold and not assume that it's COVID. We're not there yet. We do need to live our lives. We do need to continue to advance everything that we're doing, but I don't think we can go out and say, you know what, it's over. I don't know. And I'd love to hear Tom's opinion too.
Yeah, no, I agree with all that. It's all about mitigating. There's no one thing that's perfect. Hand hygiene, hand washing, mask when appropriate. Now that our positivity rate is so much lower, I think it does make sense that you can be a little bit more freer, so to speak. But just a lot of common sense. If you're going to be in a big crowded area with a bunch of people that you don't know or you're usually not around, then masking still makes good sense. In terms of the vaccinations, highly recommend them. I still strongly believe that everyone's going to be affected by this virus. You're going to develop immunity one way or the other, either through a vaccine or through getting the disease itself. And everything that we know and learned is that there's a lot more likelihood of severe complications if you get the disease. If that's how you want to get your immunity, by getting the disease, then you're just taking a larger chance. Will there be some side effects to the vaccinations? Of course, there always are. But what we do know is that when we do see those side effects, so even including myocarditis with the vaccine, it's very mild and it's very short term, and the children and young adults get over it very quickly, as opposed to the myocarditis that we see with the MIS-C that tends to be a lot more severe. And so the vaccine just makes entire sense.